I'm Noreena. I started at UCB in 2011, September, and it was a BTEC Extended National Diploma in Health and Social Care that I did. I found that just through doing my research when I was interested in getting into health and social care. Well, at first, when I did my research, I was looking on the internet at what colleges provided something around health and social care. I found out that a BTEC in health and social care existed and that could get me into nursing, or I was also thinking of being a paramedic at the time. So I looked into colleges that did it, and I found that UCB was one of them. I found a few others that did as well, so I thought I'd give UCB a shot, and I came in and I said hello, and I got a really good vibe. I thought the lecturers were all down to earth, all said hello to me, and wanted to have a normal conversation and everything, and I thought this is a good vibe, and I think this is the place for me really, and I thought that I could relax and be myself, so I thought what a better place to start really. So I'm a staff nurse at the moment in a local hospital, and I'm on a liver gastrointestinal ward, medical, so I work there now, and I've been there for about 5 to 6 months full time. What I like about my current job now is that it's teaching me an immense amount of knowledge and things. What you'll find is, like at uni, you learn all the basic things and everything, but what I found is that when I first started, the learning really starts. And on the ward at the moment, the amount of skills that I've now picked up and I've practiced, and at first you're not confident, but then you practice more and you become competent at it. I can see how far I came from the first beginning weeks to now, which I think is absolutely fantastic. And relating it to UCB, I feel that when I was here, even though it was a few years ago, there was placements that were provided, so that helped me get my feet in the water, or just to see what things were like in that sort of area. But not only that, the lecturers were also nurses in practice and previous nurses as well, so they could relate whatever they were teaching us to real practice as well. So I found that really useful, because whilst learning, they could help us to enjoy what we were learning as well, because they were relating it to what we all wanted to do. So I found that to just be a bonus really. I'd say the best advice would be that if they're unsure of what area within health and social care they want to go into, for example, I was interested in either being a paramedic or a nurse, I wasn't quite sure. I thought I want to get into something that's regardless going to get me on that path. So what I would say is, even if you're unsure and you have a rough idea that you want to get into something in and around health and social care or nursing, but you're not sure of which area, I'd say it's absolutely perfect for you, but just make sure that it is for you as well, and make sure that that you're making the right choice, and when you do make that choice, it's going to be the right choice, because everything's there to support you along the way, and it's going to be the best way to get on your path anyway.